Welcome to Dermoscopea Little Bites. In this episode, we will look at the dermoscopic features of a basal cell carcinoma. A dermatoscope is a valuable clinical tool, which allows us to look deeper into the skin through a combination of magnification and illumination. We can then appreciate specific diagnostic features not visible to the naked eye, which can improve the accuracy of our examination. Basal cell carcinoma is the most common type of skin cancer. It is considered low risk as it tends to grow slowly and rarely spreads beyond the skin, but it can cause localized destruction of the skin. This is an example of a basal cell carcinoma. We see a pink nodule in the infraorbital area, and if we shine a light over the lesion and slightly stretch the skin, we will be able to appreciate a pearly edge, which is typical of a basal cell carcinoma. This is another example of a basal cell carcinoma, or BCCs. Here we see another common feature of BCCs, ulceration, as these tumors tend to be very friable. And another BCC. Notice the small dots of pigment which are just visible to the naked eye. The most common dermoscopic features of a BCC include a vascular pattern called arborizing telangiectasia, which mimics tree branches. Another important feature of BCCs are areas of pigmentation called blue-gray ovoid nests or globules. These correspond to nests of melanocytes, which are the pigment-producing cells of the skin. This BCC has blue-gray globules alongside typical arborizing telangiectasia. Here is another BCC with a large brown-gray ovoid nest and arborizing telangiectasia. Ulceration is commonly seen, although this feature is not exclusive to BCCs. This example of a BCC demonstrates a large area of ulceration in addition to arborizing telangiectasia. And here is a similar example with arborizing telangiectasia, a superficial erosion, and blue-gray globules. We are also trying out a new technology with the use of USB microscopy. This is widely available at a very small cost and produces higher magnification of skin lesions than a typical handheld dermatoscope. These images show the same features of a basal cell carcinoma previously seen with dermoscopy, here with arborizing telangiectasia and blue-gray globules. Arborizing telangiectasia is clearly seen again here. To find out more, visit our website, join us on YouTube, and follow us on Instagram.